COVID-19 dominated all the health news again this week. We saw a lot more national chains announce that masks are now going to be required. So now we've got Walmart, Lowe's, CVS, and the list is growing. More and more people are focusing on masks as a way to tamp down this virus, and that's all good, except, well, they are kind of irritating to wear, right? And they do kind of change the way that you sound when you put on a mask, as I just did here. And if you have hearing loss, then it's a more serious problem because it can really affect how well you can perceive conversation and the visual cues associated with understanding exactly what someone is saying to you are so important. So when it comes to matters around hearing, I always turn to the Hearing Center and audiologist Emily Bondus. Thank you for joining us this morning, Emily.
Morning.
And Alison Schortgen.
Good morning. Thanks for having us. It's been a bit. A lot's happened since we've last been here.
Man, isn't it, though? So, yeah, I took the mask off because I hate them. I wear them, but I hate them. I think we all do. And if you have a hearing loss, this is posing a real problem, isn't it?
Yeah, it really is for a couple of reasons. Well, first of all, obviously, if you muffle the sound that a person is hearing, it's not going to be as clear, no matter if you have normal hearing or if you have a hearing loss. If you have a hearing loss, it's just more of an amplified issue. And then the second issue is making sure that those that do have hearing aids keep them on. People are pulling masks off, and unfortunately, we're seeing a lot of lost hearing aids. So if you're walking around the streets of Fort Wayne and you find a hearing aid, it's probably due to a mask and COVID.
I had never thought of that, but yeah, that makes a lot of sense. If you haven't, because 80% of people have an over-the-ear hearing aid, right? Mm-hmm. So the strap going around your ear, and you take your mask off, and your hearing aid goes with it, and wow, yeah, that is a big challenge.
We've had I think a record number of loss and damage claims this past few months. So really working on strategies now and informing our patients on how to keep in mind that you can wear a mask, but be careful when you take it off, or even find a mask that ties behind your head so to avoid the risk of that.
Just out of curiosity, if I find a hearing aid, is there a way to track it back to the owner somehow?
There absolutely is. All hearing aids have a serial number somewhere on them, and so if you find a hearing aid and bring it back into the hearing center, we can look at the manufacturer, call the manufacturer, give them the serial number. They can tell us the office that it was fit at, and if we can get it back to that office, they can then
kind of track it
they
back.
Can give it to the patient. Yeah.
Okay, that's good to know. So tell me what kind of challenges beyond the losing your hearing aid are masks causing for people with hearing loss?
I think one of the big challenges is just being able to hear and understand what people are saying. So the research is showing that wearing even a cloth mask or a surgical mask, it really decreases the audibility of the high pitches that are coming through in somebody's voice. So it sounds like the S, F, T, H, S. If you couple that with the fact that most patients who have hearing loss, they have that hearing loss in the high pitches. So if they are a patient who is not even amplified or doing something about their hearing loss, they're going to struggle even more to hear and understand what people are saying. Somebody who's wearing hearing aids, even if they're fit appropriately, they're going to struggle to understand speech because, again, they're wearing hearing aids set for conversation without a mask over the face, and so if somebody's wearing a mask, they're going to struggle to understand because they're not hearing, again, those high frequencies. Take it one step further. If the N95 mask that medical professionals are wearing, that really decreases overall volume for patients to the point where we're getting 30% less audibility of speech, which translates to 10% less intelligibility of speech. So if a medical professional is wearing an N95 mask and talking with somebody who has a hearing loss, that is even a bigger challenge from that standpoint.
Yeah, and then add to that the plastic shield that some people are wearing in an ICU environment. They've got what's called a PAPR, which is a fully enclosed positive air pressure hood over the top of that. Yeah, I can imagine if you have hearing loss, that is a real communications challenge.
Yeah. And I think what Alison was saying, I mean, the 10% doesn't seem like a lot, and to me, who I have normal hearing, and I probably could get 100% of words, the lists we try. So 90% is still pretty good, but a patient who has, let's say, on good days, 60% intelligibility, or they can understand 60% of the words, and that's even with a hearing aid. So if we take out that 10%, that's 50%. And if you're dealing also in medical situations, going to doctor's appointments,
right,
that, you need to have strategies to help you get through these times.
So what are some of those strategies?
Well, I think the first one is to be patient with everybody, and that goes for all of us during this COVID times. Also to ask for people to repeat things. And if you do have a hearing loss, make sure the people around you are aware of that. They may not see your hearing aids because they've got a mask on. And now these days we're all looking at each other's masks. So to, ask for people to repeat things, to slow down.
And I think even when you talk about repeat, you think, well, I'm just going to say it louder, and I'm going to say the same thing. That doesn't necessarily always help. I always tell family and friends of my patients, don't repeat it, don't just scream it. That's going to distort things more. Sometimes just rephrasing it, using different words, will make a huge impact on, at least the patient can then get enough cues to figure out, oh, this is what they're talking about. I think couple that with the fact of the patients, people who have hearing loss, whether they realize it or not, they rely a lot on visual cues. And I know for myself, being able to see people's faces and watching their the cues as to, are they happy, are they sad, are they angry, watching, can I understand what they're saying because I'm able to see the sounds on their lips. It makes a huge difference in being able to hear and understand people. So there's been a lot of talk in the hearing loss community about the mask with the clear shields, so that you can still see a patient's face or a person's face, to make that easier for them. You said be patient. The listening fatigue of those who have hearing loss in this time is increased a lot. I know for myself, I'm a lot more tired having to talk to people in mask all day long because it's harder to hear. I have to work harder.
Yeah, and just for those in the audience who don't recall, Alison does have hearing loss and does wear hearing aids. So, and you've had that since childhood, right?
That's correct. Yep.
Yeah. So that hearing fatigue, what'd you just call that?
Listening fatigue.
Listening fatigue. Yeah, that is a big challenge.
And also that relates back to a lot more people are seeing too, the effort to listen. And we talk a lot, and we've talked, I think, a couple times ago about, how hearing aids are even playing a role in dementia, because now you're having to put more effort into listening. And so that effort that, maybe when used for memory and other features is being strained in different ways.
And one of the things that we're learning about COVID is it is going to bring about an increase in hearing loss. Hearing loss is a symptom and associated with the disease.
Right. I think we're just starting to see some studies very early about, how COVID may be related to causing hearing loss, whether it be the actual virus attacking the inner ear. They also may be related to some of the drugs that are going to be used. So I think, it's early on, but we're going to be seeing some things, whether it's sudden hearing losses, and those are things that we definitely encourage, if you notice a sudden change, to come into our office immediately.
Yeah, I've read cases. There are some studies I just was studying this morning, and in recovery, people had never had a tinnitus problem, but after the disease, they do, and they're having. If you had hearing loss, your hearing loss is accelerated after your hospitalization. A real problem.
Yeah, and I think another thing we've noticed too is a lot of people are coming in with tinnitus or ringing in the ears, and we're all under a lot of stress, jobs and wearing masks and such, and so I'm not surprised that we're seeing an increase in patients coming in reporting accelerated ringing.
It's time for us to take a quick commercial break, but when we come back, we're going to talk about something that may not have been done when you had your hearing aids fitted that can result in really less performance than you were hoping for, and what you can do about that if you have hearing aids and really just aren't satisfied with how well they're working. So a lot more to talk about with Emily Bondus and Alison Schortgen from the Hearing Center as we continue here on the Health Call Live Radio Hour on WOWO. So if I have hearing aids and I'm just not satisfied with the performance that I'm getting out of these things, what can I do?
I think there's a lot of factors that can come into play, but I think there's two big factors that I really tell patients are contributors to your success. The first is there is just some adaptation and counseling that has to happen. A patient needs to get used to hearing what they've been missing, and they also need to know what to expect because there is that adjustment period. It's not very nice to listen to when you first get hearing aids because that's not your normal. I think the secondary factor is audibility. So a lot of times when patients are first fit with hearing devices, they want us to just turn it down. If I turn it down to where a patient feels like it's comfortable, I always tell them, you're really paying a lot of money for what you're used to. Let me give you the sound that you need back, the volume that you need back, because that's going to help with audibility of speech. And the only way for us really to ensure that a patient is getting audibility of speech, when we fit hearing devices, we fit to a prescription. So there's been lots of research that's been put into developing prescriptions for different types of hearing loss and what does a patient need if they have, a mild hearing loss. In order to verify that prescription or the hearing aids are giving you what you need is something called real ear measurement. So every ear is a little different in size and shape, and that amazingly can affect that prescription that is recommended for that patient. So if Emily's ears are, really small and tiny, we might be giving her too much volume because we don't need as much volume to give her that prescription she needs. On the flip side, if Lee's, ears are really big, the prescription that is recommended may not be enough because we need more volume to get to that same level of prescription. And so we do something called real ear measurement so that it's fine-tuned and tailored to the individual person to ensure that they're getting that audibility of speech.
So my understanding is you've got a map or a graph that shows what my hearing loss is and the prescription, what the hearing aid is supposed to be putting out.
Correct.
And then you put a tiny little microphone inside the ear along with the hearing aid. And watch to make sure that what that microphone is hearing is exactly what the prescription is. So you're matching the actual prescription to what's coming out of the hearing aid in my ear. Did I get that right?
Yeah, so exactly. So we're using a very, very fine probe microphone, and we put that in the ear in a certain distance right around a little bit before the eardrum is where we're looking at how that sound is. And then we're measuring how the hearing aid responds to soft sounds, medium sounds, and loud sounds. And we're actually using speech. It's a set amount of words that no one would understand, but based on different languages, that's all put together. And so it's actually able to match what the hearing aid's putting out. So we can see if the hearing aid says it's putting out this much, the prescription or the manufacturer says this, we can actually see if it's meeting those targets.
So if I did not have that done during my fitting, is that something you can do for me?
We can. For most patients, if they'd like to know if we can do that, they can call our office, and as long as we're able to work with that particular manufacturer's hearing aids, we could bring them in. There is a nominal charge, but we would bring them in and be able to measure and do real ear on them to see if their hearing aids are actually performing the way that they're supposed to.
And I would say even those manufacturers that they have their software locked, or if somebody bought an over-the-counter device and they wanted to see how well am I matching where I should be, we can do the real ear measurement for them. What we can't do, what we're limited on, is we can't make the changes to the devices to basically match that prescription. But we can show them, yeah, you're not anywhere close to audibility of these speech sounds. That's why you're struggling with this device.
Ah, yeah. There are a high percentage, so about 16% of the people who need hearing aids actually use them. And then out of those people who buy hearing aids, a high percentage leave them in the drawer because they just aren't happy. So if I'm that person, I've spent the money, but I'm not getting the benefit. Here's a step that is going to help me walk that.
Yeah. And it's definitely a good step to take to make sure that audibility isn't a factor. There certainly are other factors that can lead to dissatisfaction. I think if you're ensuring that the hearing aids are set appropriately, then we can talk a little bit more about realistic expectations. And these are the limitations of hearing devices. I always tell patients they're not perfect. Nothing is as good as the ears that we are given when we're born. For most of us.
My ears.
Yes. Nothing is as good as normal hearing. So if somebody with normal hearing is having trouble in a situation, if you wear hearing aids or you have hearing loss, guess what? You're going to have just as much trouble as them. More than likely, you're going to have more trouble.
Yeah, that makes sense. And your hearing loss changes over time. So if you got hearing aids 5 years ago, not only has technology changed, but your hearing has changed and it's time for a tune-up. Do people come back and get tune-ups as often as they should?
At our office, we try and have patients come back about every 6 months for just checks and then check their hearing every year. And of course, if there's been a major change, then we do modify the hearing aids or even minor changes. But it's good to keep an eye on that. And it also is mentioning we're checking not just their hearing, but how well they're understanding words. In the last segment, we talked about audibility and understanding, and if that can change over time. So if somebody used to get 100% of the words and now they're down to 50%, that's really going to affect not only how they perform, but just how they even do with hearing aids. And Real Ear can help us too in those situations by making sure we're maximizing the hearing aids. And if we're maximizing hearing aids, giving that patient the best opportunity to really perform well, given their limited understanding.
Okay, so how you only do this measurement in the Fort Wayne office, right? Your main office here in Fort Wayne?
We, at all 4 of our Fort Wayne offices, we have this equipment to be able to do it. The equipment is expensive, and at our satellite offices, we're not there every day. So the size of the equipment and the expense of the equipment, at this point, we haven't been able to get it out to those satellite offices. That's in our long-term goal and plans, but we can always bring those patients from the satellite offices to Fort Wayne to do it as well.
And that explains why some places just don't offer this service, because that equipment is expensive, right?
It is, and it's been a really good, I think, as far as our practice goes, changed our performance as far as I've definitely seen patients happier after their fittings, and it really does help that we have that equipment now. And so I appreciate, just as an audiologist, being able to do that for my patients. And it definitely, I think, has improved people keeping their hearing aids, less returns, and more satisfaction, and almost easier for them to adapt to them, I think. So.
When I think for patients, if they see that prescription, they see the objective measurement, they see, okay, this is the volume I need, I'm going to adjust and adapt to it. Whereas without it, they're thinking, turn it down, this is too loud. But we don't really have an objective way to show that, no, this isn't too loud, this is really what you need.
Yeah. That makes a lot of sense, because as you just said, I'm used to hearing things at level 1. Now I'm hearing on level 4. That's weird, but level 4 is really where you need to be.
Yeah,
that makes a lot of sense. Hey, time has slipped away from us. I want you to visit the Hearing Center. You can go to enthearingcenter.com online and find out more. Real ear measurement available in all 4 Fort Wayne clinics, and the remote locations, you're just going to have to come in. But it sounds like it's well worth doing. If I'm just not satisfied with my hearing aids, why not have a look and make sure they're doing what they're supposed to do? And that's what Real Ear Measurement does. Emily Bondus, Alison Schortgen from the Hearing Center, thank you. Glad to have you here.
Thank you. Thanks for having us.